Hi everyone, welcome back to part 2 of lecture 6. We started out with just talking about most of some examples of biomedical etiologies of intellectual disability that can be inherited or not inherited, that can be related to genetic transmission, difficulties with or problems on some genes or combinations of genes. And now we're going to talk about some maternal considerations. So first, just rubella, syphilis, and also blood group incompatibility. It should be noted that having a different blood type or specific blood type incompatibility, with the born child does affect usually the second and subsequent children and not the first. So now looking specifically at substance exposure, and again, looking at this across those 4 different types of etiologies, this can be looked at as a social or an educational or a behavioral, most likely, risk factor. So when we're looking at fetal alcohol syndrome, we see this in about 1 to 3 cases per 100 or per 1,000 births, and it is a leading cause of intellectual disability, but again, this isn't necessarily something that, again, we don't, as we'll see in just a second, it's really difficult to know how much is too much. So that's why general guidelines are not to use alcohol at all while pregnant, but risk rates are particularly high during the first trimester. Research really can't pinpoint how much exposure is safe, and I want you just to think for a second why that might be the case, why it's difficult to actually pinpoint that and know exactly how much and at what time things don't go so well. And the reason for that is because it's really difficult to get IRB approval to do randomized control trials with women that will agree to drink and not agree to drink while they're pregnant. It's not considered unethical. So it's really difficult to know how much, and it's usually information that's collected after the fact, after a diagnosis is made. Symptoms include central nervous system dysfunction, craniofacial malformations. A lot of times you'll hear people say that you kind of can tell by looking at someone whether or not they have fetal alcohol syndrome, and it can be associated with certain facial features, but that's not always the case. Additionally, it's associated with inhibited growth development. There also are a lot of behavioral effects in addition to possible intellectual disability, which look a lot like attention deficit disorder or distractibility, impulsivity, difficulty with just emotion regulation in general, also memory, problem solving, and organizational difficulties. Again, just really want to point out that all of these behavioral effects aren't always caused by fetal alcohol exposure at all. It's just that with individuals that do have fetal alcohol syndrome, we also a lot of times see behavioral impacts as well. So substance exposure, again, we're looking at illicit drug use. There's a wide array of behavioral effects that have been hypothesized, included social, learning, language, and also those attention difficulties and emotion regulation, in addition to possible intellectual disability. But research conclusions are really ambivalent because drug abuse obviously more often than not occurs simultaneously with other events like smoking, alcoholism, and environmental deprivation that affect developmental outcomes. So it's really important, it's really difficult to pinpoint which type of illicit drugs cause what, because more times than not, when individuals are using illicit drugs, they're not just using one drug. So they're not just using heroin. Usually then there's also alcohol use and tobacco and other things like that, or marijuana. It's difficult to pinpoint what illicit drug was the cause. I worked on a research study for a while when I was in between undergrad and graduate school that looked at just prenatal toxin use over a long period of time. So it was a longitudinal study. And what we would do is we would recruit mothers after they gave birth and if they tested positive for any type of illicit drug. And then we would track the child's progress over time and get information from the parents about what substances they were using. And again, very rarely was it a single illicit substance that was used. They're usually polysubstance users. So then it just makes it really difficult to pinpoint at what levels are dangerous, and also what combination or what types of drugs are most dangerous or put an individual most at risk. Additionally, a lot of kids are born that are exposed to illicit drugs that don't have any impact at all. So it's really difficult to tease this apart, but it's generally a good rule of thumb and recommendation from medical professionals and all sorts of organizations to not use any type of illicit drugs or alcohol while pregnant. Prematurity, so having an infant that's premature also puts them at a increased risk for various developmental delays, including intellectual disability in some cases. But due to the way that medicine has progressed in the field of medicine, survival rates for premature infants have increased significantly. And additionally, we have a good understanding about where we should intervene, and due to early intervention services can really help offset some difficulties historically we've seen with prematurity. Other developmental risks outside of low IQ also are cerebral palsy, attention deficits, and neurological and other medical complications. So common postnatal concerns. So right after when the child is born, and we're kind of going to talk about each of these things. So head injuries. And again, this typically leads to a biological etiology of intellectual disability if it does cause intellectual disability. But also, again, head injuries have various different reasons for why they occur, some of which can be a behavioral, so something happens and linked to child abuse. Some can be due to lack of education or lack of social support. So again, it can fall depending on the specific situation or the specific details of the situation, can emerge as a risk factor or an etiology for intellectual disability across all of those different areas. Child abuse is typically primarily considered a behavioral concern, but again, can lead to head injury, could be due to lack of education, parenting skills, or lack of social support. And this can result from and aggravate primary disabilities. So sometimes child abuse can occur as a product of a child already having a possible disability, and just frustration or lack of education and social support that a family may have, and that can aggravate already existing disabilities. Lead poisoning, again, really falls along all of these different domains, and I'll talk a little bit more about that in a second. And additionally, nutritional deficiency. So child abuse, which is primarily looked at as a behavioral etiology. Children with disabilities are less able to defend themselves and have a greater difficulty determining appropriate and inappropriate contact, which puts them at greater risk for child abuse. Additionally, individuals or kiddos with disabilities are less likely to report abuse and are more dependent a lot of times on those who abuse them, and are a lot of times seen as less credible when they report abuse. So it just puts them at a higher risk for child abuse. And again, just like I keep putting these disclaimers up, I'm not at all saying that individuals with disabilities, their caregivers abuse them. It just puts them at a higher risk depending on some other things in their life, other environmental factors that can, again, lack of education and parenting skills, and also possibly lack of social support. So some specific types of child abuse. One is shaken baby syndrome. This can lead to brain hemorrhage, hypertension, cerebral palsy, intellectual disability, coma, and even death. Signs are vomiting, seizures, blood pooling in the eyes, apnea, so spells of interrupted breathing, irritability, sleep difficulties, and drowsiness. This again is really, really important, and again, can lead to all of these difficulties, which can be, specifically brain hemorrhage, which is a biological etiology, but due to possible, lack of education or social support, can also be an etiology. So if the parents don't have other good tools for parenting, their child, or a single mother doesn't have social support, those also could be risk factors for shaken baby syndrome as well. Lead poisoning, this is permanent and progressively damaging to the central nervous system, and really, really important. It can lead to encephalitis, which is swelling inflammation of the brain. Developmental outcomes may include seizures, cerebral palsy, and intellectual disability. One way back when this used to be a leading cause of intellectual disability. Now that we have a good understanding of how detrimental lead exposure can be to children in infecting and impacting their development, there's been a pretty good effort to like redo homes that have lead-based paint. And so that way this is kind of decreased as a cause of intellectual disability, but still, especially in some lower socioeconomic status areas or types, especially public housing, there still is lead paint there, and parents may not have the education or understand the dangers of lead-based paint. And so it still is a cause of intellectual disability that we see in children. Nutritional deficiencies, these can occur pre or postnatally. Malnutrition during gestation or the first 6 months of life can lead to as much as a 40% deficit in brain cells. And again, it's really been shown that the effects of early malnutrition in children have been viewed as irreversible, so there's no way to regain those cognitive abilities. So again, and this is, again, while a biological leads to some biological causes of intellectual disability, again, due to lack of education or social support, extreme poverty, this is something that also can occur as an environmental etiology or cause as well. Preconception. So what are some things that we can kind of do to help prevent these etiologies from occurring? Genetic counseling to see if you are possibly a carrier for a certain disorder or have a higher risk of certain things in your family. Immunization for maternal rubella is recommended. Adequate maternal nutrition during pregnancy, and then appropriate family planning, which can involve, parenting and parenting classes and making sure you have adequate social support for an individual. During gestation, prenatal care, making sure that there's adequate nutrition, fetal monitoring, protecting the mother from disease, and avoiding substances, so bad things, making sure that they don't occur, and that's those are referring to alcohol use and illicit drugs. So during gestation, genetic analysis is typically recommended when a mother is 35 or older. That's considered advanced maternal age. And this is when the risk of the disorder is greater than the risk of the procedure, and or when couples are known to be at risk. Usually genetic analysis is recommended, and that can be done through multiple different ways depending, and all of these kind of vary in their level of invasiveness. So depending on whether or not you might be at risk, whether you're advanced maternal age or no, you may be a carrier for Fragile X, if that's somewhere in your family, will determine again what level of a procedure that you may want to, that a mother may want to use. At delivery, APGAR, test of vital signs, can give us good information about whether or not an intellectual disability is present, and that's just making sure, looking at breathing, response to stimuli, the color of the child, computerized monitoring of the child right after delivery, and then screening for any specific genetic disorders that that the child may be at risk for, given your family history. Early childhood, really important prevention, proper nutrition, maintaining a safe environment away from abuse or possible dangerous situations, including, again, exposure to lead, those types of things, and then other psychosocial considerations. Again, making sure there's adequate support and stimulation in the environment. So that was just a lot of information about all types of etiologies, and I always joke that this lecture always can kind of be a bit of a downer. It's all the things that can possibly go wrong, and sometimes, individuals can be at risk and carriers for things, and be exposed to some difficult situations that lead to environmental factors, and everything can still be fine. But this lecture these two parts of lecture 6 go over all the things that can go wrong. So why do we have to talk about it? So I want you guys to think about what role or why do we care about the etiology or the cause? and what's the importance of reviewing all of these things that can go wrong and can be really scary. Whenever I lecture about this lecture, I usually at the beginning always just kind of scan the crowd and say, if anyone is pregnant, this lecture might be a little stressful or overwhelming for you. Again, take it with a grain of salt. It doesn't necessarily mean if these things happen, this is absolutely going to happen, or that you're going to have a child with a disability or an intellectual disability. The value of etiology really just helps us understand the risk or help assess the level of risk for certain types of intellectual disability. And having that information prenatally can really lead to action and proper support planning for when the child is born, knowing what supports to already have in place and what what type of education that they need, what type of medical services need to be in place. So the impact of the disability possibly won't be as great as if it was if you didn't have that information. So important thing to think about, and possibly an area you can talk about in discussion questions, based on information from the reading and references this week, is how valuable is etiology? What information is valuable valuable to know, and what is not valuable to know. And maybe it's maybe you think it's not valuable to know at all. But just kind of think about that as to why we have to talk about all these kind of depressing things that can go wrong. So I want you guys to, I'm going to close here with just a scenario because it's really important that you have a good understanding of the biomedical, social, behavioral, and educational risk factors, and understand that when you're given a scenario, you can look at it and, again, not necessarily diagnose anything, but have an understanding for what etiologies could be present in a child that's born. And so this is just a different scenario. And thinking around here, all the possible concerns. So this says a 46-year-old woman gave birth to a child at 30 weeks gestation. The child weighed 4 pounds and 6 ounces. Mom did not know she was pregnant until 9 weeks and drank on average 4 to 5 drinks per week. She has 3 other children ranging in ages from 7 to 16 years of age. One of these children has ADHD, and another one is on an IEP for a learning disability. So when you're looking at this, say, what do you think all the prenatal risk factors or etiologies could be if this child that's born to this mother ends up having a disability? Pause for a second. So when you're looking along about the biomedical area, so advanced maternal age, so the mother is above 35, so that's a biomedical risk factor. Given the situation, it sounds like things might be a little stressful. There might be some social concerns around lack of access to prenatal care and proper nutrition. Again, we don't know that, but that could be a possible thing. Additionally, behaviorally, we can look at the mother's alcohol use. She didn't know she was pregnant until 9 weeks. Perinatally, again, the child can be at risk for being premature. Or was premature, was born at 30 weeks gestation, and low birth weight. Those are both biomedical etiologies that could be present if this child were to have an intellectual disability. Again, also perinatally, looking socially at lack of access to prenatal care. And then postnatally, again, we don't exactly know what would happen here. Again, you just kind of hypothesize that, but postnatal is after birth. Apologies. And then also I think it's also important to think along those different factors, what are some possible strengths that this mother may have that we could really build upon to use supports? One of which may be that she already has 2 other children, and one of them does have an IEP or an individualized education plan, so receives special education for a learning disability. So maybe she's really aware of what services to access for this child that is going to be born and knows how to get it appropriate services. So in addition to looking at risk factors across those areas of etiology, I think it's also important to see what strengths rely on too, because again, a common theme is using strengths to help remediate any difficulties a family or an individual may have. So that is it for part 2. Thanks for your time and attention. If you have any questions at all, as always, let me know, and we'll see you soon.